There was something in my cervix, and they didn't know what it was, so they recommended that I have a hysteroscopy. A week later, I get a call from the doctor that it is adenocarcinoma and it's cervical cancer. So I go see an oncologist that tells me I can have a traditional surgery, which is a radical hysterectomy, and they cut you from one side to the other, and you have a huge incision. And I decided that I wanted a second opinion. I called Dr. Bristow at Johns Hopkins and was extremely lucky. They had an opening the next day that I could come in and see him. Dr. Bristow told me about an option that I had, which was the laparoscopic, the robotic assist surgery. I talked to a nurse who told me that she sees patients all the time that rave about the procedure. But I knew nothing about it, and I didn't know, that it was safe or not safe, or, is this something that I should do or that I shouldn't do? I mean, there's a lot, I just found out I have cancer. Normally, the other procedure is, like a C-section, so you could be several days in the hospital, and typically, it could take up to 8 weeks, 6 to 8 weeks to return to work. A week later, I was scheduled for surgery. What they do is they make these teeny little incisions, more so in my abdomen, and they go in laparoscopic, and they're able to perform the surgery. And it's a much quicker recovery. It's a much easier procedure. I'm extremely, extremely grateful. And I can say that I have these teeny tiny itty bitty little marks on my stomach that you can't even see.